So I'm sure that's been interesting, useful to swap ideas about what you can practically do. So to collect some of your thoughts and ideas, I'm very pleased to welcome to the stage Theresa Nelson, who is the Programme Director for Clinical Leaderships nationally. As you're talking, just as we did before, we'll transcribe up some of your comments. So thanks, Theresa.
Great. Thank you, Jack. Really, this sort of first bit of this session is really about hearing back about what practically you're going to do back in your organisations in terms of what you've heard from other colleagues here today. What are you going to take away? We've talked a lot about responsibility, and over lunch I've had conversations with people about, so what next? What else are you going to do for us? And I think what I really want to hear about is, what are you going to do in your organisations, and help define what it is we need to do at a national level. So I'd be really keen to understand, and also when you're sort of feeding back and sort of throughout the process, if you can start to think about what, you know, the fellowship opportunities that you've all taken part in sort of were developed sort of as part of the NLC sort of in about 2009, 2010. And obviously we're moving to a new health system now. We've got different challenges. And actually, is that model of fellowship the model that we should be taking forward? And it's great that we've had different models around the country. And what I'd really like to hear about, okay, you know, some practical things around sort of is the sort of salary backfill a fundamentally important part of that, and or should we do something more with that money in order to get more fellowship opportunities, but maybe sort of funded in a different way? And I think throughout our discussions, I really wanted to sort of us to pull out the practical things about what we're going to do, and then, okay, so how can we nationally design something that will enable more clinicians in their sort of early stages of their career to partake in this sort of opportunity? So sort of just to start then, who would like to go first in sort of feeding back what they're sort of going to do when they go back into their organisation? This table? Claire?
Thank you. I mean, we had three themes, and I think we can probably divide them into things that we individually can commit to doing, and things that we think that might help at the national level too, if that's useful. Yeah. It also means that we get to tell you what to do too, which always makes us feel a bit better.
Always makes my job easier as well.
Okay. So the first one is around the theme of evaluation, and it came up earlier. You know, all of this effort's been put into the National Leadership Council and into our various fellowships. And events like this are really useful, but we just wonder whether we're really capturing all the learning from our different experiences. And we wondered whether at the national level some kind of formal evaluation mechanism could be set up that, as part of it, allowed us to systematically collect our experiences and share them. And then individually, we began to think about what we could do to help with that. And we think there's something really important and powerful about each of us carrying the individual message of what we've been doing, sharing our experiences with the organisations we go back into, with the colleagues that we worked with, just sort of helping them get some of our enthusiasm that you can actually make a difference, you can make a positive change to your service wherever you are, whatever that is. One of my colleagues, Karen, sort of summarised that as a fellowship or a fellow reported outcome measure, so a from, analogous to a from.
Fantastic.
The second area that I think we're going to take away is the importance of networking and active networking, and you know, for us, very prosaic task is to make sure we all join up to the network. And then maybe sort of share our experiences locally again. And one of the things I wonder that we can do nationally is help support things like the network. And I know that there is a link between the NLC and the network, but formalising that, maybe even extending that, would be fantastic. And then the third thing, and this is probably personally for me is the most powerful thing that I'm taking away, is just the importance of the patient experience. I mean, we were all really moved by Bryn's talk. And it was fantastic to kind of be refocused on how important that is and putting that at the centre of what we're doing. So, you know, for me personally, I'm going to go back and actually reevaluate all of the projects that I'm doing and say, actually, well, where does the patient's experience come into this, and at what point have I really linked them into this? And we wondered whether at the national level there might be some way of us, again, formalising and capturing and sharing that, so that we're linking what the National Leadership Council is doing very definitively with what patients want us to do. And again, you know, patient and public involvement is difficult, but you know, you guys will have the expertise to make that happen, I'm sure.
Yeah, no, that's really interesting. And your first point around evaluation, I think whenever we try to explore the sort of the service impact of leadership development, it's hard, without a doubt, because there are so many different inputs into sort of delivering a service. So actually tying down a leadership development intervention directly to patient care is really hard. But I am pleased to say we have commissioned the development of a leadership development evaluation model, and we are going to use the fellowship experience as a sort of a scenario to test that model. So that work will report out in September, October time. So I really hope that we'll be able to tie down some of the outputs of the fellowship opportunities to actually the impact it's made on services. So Jean's here, isn't he?
Yeah,
Jean's here. There you are.
So you have Jean Hardacre, who's working on the project, looking at evaluation. So I think clearly it would be great for you to meet over coffee, and other people also interested in the evaluation side. So Jean's actually here to collect feedback and collect the learning. So, thank you.
Great. And absolutely agree. That this is all about patient care. So we can't lose sight of that focus. And I'm really glad that you brought that up. Brilliant. Thank you very much for that feedback. Any comments on that, or should we move on to another table? Okay, who would like to go next? Claire, that's table 7.
Thank you. This is again relating to how we make the most of the networks that are available within our own regions, and also how we bring all the networks together through the national networks like the network, and also to align it with the clinical networks as well, because if these two things are happening in parallel, and how are we making sure that we integrate the leadership development network with the clinical networks. And this is just an idea about, we have all clinical networks, they are funded by the system. It seems to me like there's a separate thing happening about the national leadership networks, and I wonder whether that sort of willingness at the national level can actually be translated in the regions as well, by having a clinical leadership network integrated with the clinical networks. Because if you don't do that, then there's a danger of running some silos and not really making any difference on patient outcomes.
Yeah, very good point. I think on that point, the sort of the CLNs, the clinical leadership networks, have been sort of in place again over the last couple of years, and they vary across the regions. So I think there is something about a consistency of, some of them are particularly proactive, and there's lots of sort of activity in terms of delivering certain service improvement projects. Some are less, some they maybe just a talk or a meeting every now and then. So I think there's something about joining the networks, but also making them more consistent in what they're doing, and sort of maybe applying that, fairly across the country. So great, good point, thank you.